the Deputy Governor, the County Commissioner, CECs, and other staff, including the health staff, the members of public, members of the Fourth Estate, ladies and gentlemen, as you are aware, coronavirus pandemic has continued to cause destruction in every part of the world, with the number of infected persons rising on a daily basis. As at yesterday, 22nd April, the infected cases in our country stands at 303, with 83 recoveries and 14 deaths, spread over 13 counties. The number of cases in our neighboring Mandera County rose from 2 to 4, and now they are 8. Thus, I welcome the 21 days lockdown of Mandera County announced by the Cabinet Secretary of Interior, Dr. Matiangi. We have made a similar pronouncement a week ago, since we realized that the travel restrictions will prevent spread of the disease, and I therefore urge our security forces to implement this order. Through the grace of the Almighty Allah and the struggle put by our health staff, together with our committee, we have so far not reported any case in our county. However, with the disease reported from all corners of the country, we are aware of our susceptibility and will therefore not leave anything to chance. We are currently on a massive sensitization campaign all over the county on COVID-19, where the populace is educated on its existence and prevention, with particular emphasis on the implementation of the national guidelines, county-specific directives, and occasional advisories from the Ministry of Health. I therefore wish to take this opportunity to thank Wajir Muslim Youth and Save the Children for partnering with the county government of Wajir to educate the population in Wajir County, that is almost the entire county population, over the Islamic perspective of the disease and its control. Ladies and gentlemen, other interventions we have put in place so far in the last 2 weeks include, but not limited to, the following. 1, we have trained 30 frontline health care workers on COVID-19 by a team from the Ministry of Health. 2, we purchased 60 beds and other supplies for distribution to the isolation wards in the 6 sub-counties. 3, we have upscaled surveillance with the capacity to respond to all alerts raised through different channels. 4, partnering with the police at roadblocks to intercept those traveling from outside the county and administer immediate screening. 5, weekly meetings by the county and sub-county emergency response committees to monitor and review preparedness and strategies. 6, contact tracing is in place. Close contact of travelers with the index cases of Mandera was tracked and found in Wajir on the 12th day since the Mandera first case was confirmed. Samples collected and put on self-quarantine until we confirmed his result was negative on day 15. Number 7, mapping of the risky group with the county with a view to heighten the awareness on the COVID pandemic in the county. Ladies and gentlemen, my government, with the support of National Public Health Laboratories, has put in place all the requisite kits and capacity to formally carry out testing of COVID-19 in our regional laboratory built by the World Bank under the East African Public Health Laboratory Networking Project, which we have just inspected. This is a milestone because Wajir Regional Referral Laboratory will be designated as a COVID-19 testing site in Kenya that will support all our neighboring counties, including Mandera, Garissa, and Marsabit. We are currently able to test at least 60 to 100 samples in 24 hours. All the biosafety and biosecurity measures have been put in place to ensure safety of our healthcare workers, the general public, and the environment at large. The personnel are provided with protective equipment and other materials. All the specimens will be decontaminated and incinerated. Our referral laboratory, which has skilled and dedicated staff, has been a great asset to our community and the entire region as a reference laboratory in clinical diagnosis, disease surveillance, and outbreak investigations. It participated in measles outbreak in 2013, cholera outbreak in 2015 and 2019, the dengue fever in 2017, Kalaza outbreak in 2018, and the Rift Valley fever 2018, among others. This laboratory has undergone progressive improvement, evidenced by the various external assessments. It started with 0 start in 2011 and progressed to 4 stars, 4-star general, Makofi, in 2018. In 2019, the laboratory was finally accredited and ISO certificate by Kenya Accreditation Services It has therefore gained international recognition as a testing laboratory. Can we clap hands for the staff here? Hiyo makofi ni kidogo bwana. Kwa nini mnanyima hawa? Nyinyi mpigie makofi. Asanteni sana. The laboratory is equipped with ultra-modern state of molecular equipment which have capacity to test and identify diseases of public health importance and other emerging diseases such as COVID-19. I sincerely thank our frontline laboratory personnel, National Public Health Laboratories, the World Bank, and the entire Health Department for this sterling progress. At this juncture, I direct the Department of Health to adequately finance the laboratory so as not to miss the ISO status and remain focused. Yes, several tests were done, and all the tests, I do not know the number, but the tests were just taken, from around, and all of them are negative. So far, so good. Mandera is likely to bring their own tests. 15 health staff were screened. All of them are negative. So we will continue praying to God that this disease is kept at bay. Those of you who are coming from Nairobi, from Mombasa, from Kilifi, wale wa Kilifi ndio wameinfect watu ya Mandera. Sasa hiyo si ni uhalifu mbaya sana. Kwa hivyo nyinyi wenyewe mjihadhari. Hata wasoshega hadi hawo mkisikia mtu ameingia mueleze tu, mtueleze. We will be picked. Hawezi kupelekwa mahali mbali, quarantine tu tunaweka mahali mzuri. Na quarantine bana mbaya unawekwa tu mahali. Bas ile kitu utafanya tu wewe ndio unajipatia hiyo chakula na mambo mengine. Hiyo mtu atajipatia.
Ona anatanga.
How many machines do you have? And how many capacity does it take by 24 hours? How many people do you need that machine?
In 24 hours we can screen up to 100. Yeah? If they are few, in fact, if the samples are few, they will take less than maybe an hour or 2 hours or so. But in a day, 24 hours, we have the capacity of testing up to 100 per day. That's a big number. But we are hoping against hope that no case comes here, at least from this county. Lakini tujihadhari, tafadhalini, watu kutoka Mandera. Unajua watu ya Mandera kidogo wanajua kupita panya routes, si ndio? Nasikia wengine wamepita Korofara huko juu. Na wamepitia huko Sabule, sijui wapi, Pandio. Wengine sijui, That is very serious. Tunataka kila mtu, hata wale wanakaa badia huko, wakiona gari kama hiyo wa report kwa polisi hapo, gari hiyo ishikwe. Mandera is locked down kabisa. Yes, several tests were done, and all the tests, 15 health staff were screened. All of them are negative. So we will continue praying to God that this disease is kept at bay. Those of you who are coming from Nairobi, from Mombasa, from Kilifi, wale wa Kilifi ndio wameinfect watu ya Mandera. Sasa hiyo si ni uhalifu mbaya sana. Kwa hivyo nyinyi wenyewe mjihadhari. Hata wasoshega hadi hawo mkisikia mtu ameingia mueleze tu, mtueleze. We will be picked. Hawezi kupelekwa mahali mbali, quarantine tu tunaweka mahali mzuri. Na quarantine bana mbaya unawekwa tu mahali. Bas Ile kitu utafanya tu wewe ndio unajipatia hiyo chakula na ile mambo mengine. Yeah. Hiyo mtu atajipatia.
Ona anatanga.
How many machines do you have? And how many capacity does it take? Right, 24 hours. How many people do you need to such machine?
In 24 hours we can screen up to 100. Yeah. If they are few, in fact, if the samples are few, they will take less than maybe an hour or 2 hours or so. But in a day, 24 hours, we have the capacity of testing up to 100 per day. That's a big number. But we are hoping against hope that no case comes here, at least from this county. Lakini tujihadhari, tafadhalini, watu kutoka Mandera. Unajua watu ya Mandera kidogo wanajua kupita panya roots, si ndio? Nasikia wengine wamepita Korofara huko juu. Na wamepitia huko Sabule, sijui wapi, Pandio. Wengine sijui, That is very serious. Tunataka kila mtu, hata wale wanakaa badia huko, wakiona gari kama hiyo wa report kwa polisi hapo, gari hiyo ishikwe. Mandera is locked down kabisa. Ladies and gentlemen, on unrelated matter, we have received complaints from our religious leaders over the increased moral decadence or decay and social vices in our Wajir town. It is reported that illicit drugs are sneaked into the country from Ethiopia through Moyale. A Land Cruiser branded as an ambulance overturned around Modogashe en route to Nairobi, and loads of bangi were part of the consignments it was carrying. The dealers in this unscrupulous business are mostly foreign maids and border transporters. We urge the security agencies, together with the Wajir municipality, to enforce unit to come the town and apprehend those involved in this illicit trade. And I'm glad that the county commissioner is hearing, and I think he will take note of that one. Ladies and gentlemen, let us support our needy Muslim brothers and sisters during this unique holy month of Ramadan, as the curfew will not allow us to have them be with us in our houses for the iftar, as has been the case before. Finally, we urge all of you to keep on embracing the recommended social distance, washing hands with soap and water, sanitizers, wearing face masks at all public gatherings, and above all, staying at home. I wish you all, Muslim brothers and sisters all over the world, and Wajir in particular, Ramadan Mubarak. Assalamu alaikum wa rahmatullahi wa barakatuh.